Blood thinners are prescribed in atrial fibrillation mainly to prevent stroke, but new research suggests that some anticoagulants may have another potential benefit. In patients living with both atrial fibrillation and Alzheimer's disease, NOAC use was associated with a slower rate of cognitive decline. Researchers analyzed 7,308 patients with Alzheimer's disease and atrial fibrillation using Swedish National Registry data. More than 3,000 received no anticoagulant. Over 2,000 received warfarin, and nearly 1,700 were treated with a non-vitamin K oral anticoagulant, or NOAC. The most interesting finding involved cognition. NOAC users experienced a modestly slower decline in mini-mental state examination scores. Compared with no anticoagulation, the difference was about 0.23 mmC points per year. Compared with warfarin, it was approximately 0.21 points per year. The difference is small, but potentially important when accumulated over time. The association was not limited to cognition. NOAC treatment was also associated with lower risks of ischemic stroke or systemic embolism and all-cause mortality, without a statistically significant increase in major bleeding compared with no anticoagulation. One possible explanation for the cognitive finding is prevention of microemboli and silent cerebral infarctions, reducing cumulative vascular injury to the brain. But this mechanism remains a hypothesis. There is an important limitation. This was an observational study, not a randomized clinical trial. It does not prove that NOACs slow the progression of Alzheimer's disease, and anticoagulation should not be started solely to preserve cognition. However, for patients with atrial fibrillation who already have an indication for anticoagulation, these findings add intriguing evidence that NOAC therapy could potentially provide benefits extending beyond conventional stroke prevention.